What's my dispatch? My dispatch is an 80-year-old female complaining of chest pain. Okay, I'm going to start with Penman. I'm going to go through my list. PPE. I need to ensure that I have proper PPE before I enter the scene. This can include gloves, face masks, gowns, eye protection. I'm just going to go in with a face mask because I don't think any other PPE is necessary. Environment safety. Is my scene safe? Yes, my scene is safe. Number of patients, 1 female 80-year-old patient. From there, I'm going to go to mechanism of injury or nature of illness. I'm going to determine that this is a nature of illness just because it is concerning chest pain. And then from there, I'm going to move on to additional resources. At this moment, I am going to say that additional resources are needed. I'm going to call for an ALS unit. And then from there, I'm going to move on to need for C-spine. Although I'm going to consider C-spine, I don't think that it's necessary at this moment. From there, I'm going to move on to verbalizing my general impression of the patient. As I walk in, I see the patient clutching her chest. Just from seeing that, my general impression of the patient is that she is suffering from chest pain. From there, I'm going to move on to assessing her alertness. That is through AVPU, alert, verbal, pain, unresponsiveness. I'm going to start by asking her a couple questions just to assess her alertness. Hi, ma'am. My name is Diana. I'm going to be your EMT today. What is your name? She said her name is Margaret. Okay, Margaret, I'm going to ask you a couple more questions. You know where you're at right now? She said that we are in Hollister, California, which is true. Okay, Margaret, what year is it? She said it's 2025, which is true. Okay, Margaret, I have one more question for you. Why did you call us out here today? She said that she called us because she was experiencing chest pain. Okay, just from asking her those questions, I am going to say that she is ANO times 4. She is alert and she is verbal. From there, I am going to move on to determining her chief complaint, which, as she said, I'm going to determine is chest pain. That is her chief complaint. And then from there, I'm going to move on to my ABCs, which is airway, breathing, and circulation. Just looking at her, I can see that her chest is rising and falling. However, just to make sure she has adequate airway and breathing, I'm going to ask for a pulse oximetry reading. I'm going to clip that on. Her pulse oximetry reading is 93%, which is kind of low. So to address her breathing and airway, I am going to place a nasal cannula on her. And I'm going to attach that to an O2 tank, and then I'm going to set that to 2 liters per minute, and that's just going to help her breathe a little better. And then from there, that was the oxygen therapy that I provided to her. From there, I'm going to move on to circulation. The first thing that I'm going to look at is if she has any major bleeding. Just looking at her, I don't see any major bleeding. The next thing that I'm going to assess with her circulation is her skin. Her skin looks a little pale. However, that's the only thing that I'm really noticing. And that's pretty common in people with chest pain. She looks a little pale. And then from there, to also assess her circulation, I'm going to check her pulse. I'm going to check her radial pulse right here. Her radial pulse is pretty high. It's at 120. From there, I'm going to make my transport decision. I'm going to say that Margaret is a critical patient, and I'm going to call for transport immediately, and I'm going to make this a code 3. And then after I have made my transport decision, I am going to move on to history taking, which is going to be my OPQRST, and I'm just going to ask her a few questions. I'm going to start with onset. Margaret, did this pain come on suddenly or gradually? It came on suddenly. Okay. Provocation. Does anything make this pain feel better or worse? She said that sitting up makes it feel better. Okay, Margaret. So keep sitting up just to make you as comfortable as possible. And then from there, we're going to move on to quality. Margaret, can you describe this pain to me? What does it feel like? She says that it feels like her heart is constricting. Okay, we're gonna move on to radial. Is this pain spreading anywhere else, or is it just in your chest? She said that it's spreading to her shoulder, her right shoulder, and that it's spreading to her back. So it is radiating. Okay. We're gonna move on to severity. Margaret, on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever experienced in your life, how would you rate this pain? A 7. Okay, that's pretty high. From there, we're gonna move on to time. Margaret, approximately when did this pain begin? 15 minutes ago? Okay, it's pretty recent. After my OPQRST, I'm gonna go through my sample. Margaret, do you have any allergies? No allergies? Okay. Do you take any medication? You do. She takes aspirin and she takes nitroglycerin. That was prescribed by her doctor. Okay, so do you have a past history with heart problems or chest pain? Is that why you take that medication? You do. Okay. Margaret just told me that she has had a heart attack before. About 4 years ago, she had a heart attack, and that is why her doctor prescribed her that medication, and that she has also had a heart surgery done after that first heart attack. Okay. So that was her past pertinent history. I'm going to move on to her last oral intake. Margaret, what was the last thing you ate today? Oatmeal this morning. Okay. What were the events leading up to these symptoms? What happened before you felt this chest pain come on? She was taking a walk around the park. Okay. So that was the events leading up to these symptoms. From there, I am going to verbalize my I'm going to verbalize what I think the affected system is, and I'm going to say that the system of her body that's being affected right now is her cardiovascular system. So I'm going to perform a secondary reassessment or a secondary assessment, sorry. I'm going to start by palpitating her chest. Margaret, I'm going to have her take her shirt off, and I'm going to palpitate her chest first. And I'm just going to go like that. Okay. And then I'm going to do her back as well. Same movements on her back. Okay, just making sure I don't feel anything abnormal. And then from there, part of my assessment, I'm also going to asculate her lung sound using my stethoscope. I'm going to first listen to her lung sounds on her clavicles right here. And then her mid-axillary line right here under her arm. And I'm also going to listen to her lung sounds on her back. Her lung sounds pretty normal right now, so I'm not too concerned about that. From there, I am going to provide treatment as part of my assessment. I am going to administer the aspirin and nitroglycerin because I am able to assist her with her prescribed medications. I am going to assist her with taking her aspirin and her nitroglycerin. That is the treatment that I am providing for her at this moment. From there, I'm going to ask for vital signs. I am going to get an updated pulse. Again, checking the radial pulse. Her pulse is still at 120, which is pretty high. I'm a little concerned about that. I'm going to take her blood pressure now. I'm going to put my blood pressure cuff on her, and I'm going to get my stethoscope, and I'm going to check her blood pressure. Her blood pressure is reading 150/90, which is pretty high. I'm a little concerned about that as well. And then her respiratory rate, just looking at her, is going to be 20. Now I'm going to look for an updated oxygen oximetry reading. I did one earlier, and I had been at 93%, and I had administered oxygen therapy via nasal cannula. And just reading it again, I see that it's gone to 96%. So her pulse oximetry has improved. So that's good, thanks to the nasal cannula. And then from there, I am going to reassess my patient every 5 minutes, and I'm going to reassess her by getting updated vital signs. And I am going to also verbalize my general field impression. My general field impression is that she is suffering from a heart attack, just because she has a past history and because she is showing the signs and symptoms that would indicate that she is having a heart attack right now. So that is my general field impression of my patient. And then again, as I said earlier, I would reassess her every 5 minutes and I would recheck her vital signs. And then from there, the report that I would hand off to the emergency department would include the patient's name, age, her chief complaint, the treatment that I provided, which was the aspirin and the nitroglycerin and the oxygen therapy via nasal cannula. And then I would also include the medication that she takes. Again, aspirin and nitroglycerin, and her past history with her heart attack and her chest pains. I would include all of that in my report to the emergency department when I handed her off.